All right, so I am going to kick us off tonight with just a general talk really quick about natural medicine. I think you all know Alexis, and so you probably are all very well acquainted with what natural and alternative medicine is all about. So I'm just going to give a very short introduction, and then I'm going to talk a little bit on the naturopathic side of things about thyroid and adrenal treatment and diagnosis. So this is our part one. We're going to play, I think we're planning on doing a couple more over the next couple of months. So we're starting with thyroid and adrenal health today. And we were originally going to do thyroid, and I added in the adrenal. This is me, where you can find me. I'm a naturopathic doctor by degree, but really a homeopath at heart. Alexis and I were talking about that earlier. It was really my first love. I'm going to let her have all the fun with that tonight, but it's a great duo for us to be doing this together. So the first caveat is you are a whole person, not a car. You are not broken up into bits. And I think this really comes from homeopathy, but I use it a lot in my assessing and treating from a naturopathic perspective as well. This is a little thing, the wondrous things you can find on the internet that I saw that's so fitting here, that the cure of many diseases is unknown to physicians because they are ignorant of the whole, for the part can never be well unless the whole is well. And that's really what we're talking about. Thyroid gets singled out, and the reason I want to emphasize this now is the thyroid is just a piece in a big puzzle. So our entire system, hormonal or otherwise called endocrine system, is one interconnected complex system. None of the glands that make up that system, and we're going to look at them in a minute, are separate from each other. Well, physically separate, but they are chemically, physiologically connected, and they rely on one another to function properly. The thyroid gland is the one of all of them that gets tested the most, whether in the conventional world or the alternative world, and therefore it's treated most frequently. I meant to put up a little slide about the frequency of thyroid medication prescription, but I think it is still the top most prescribed drug in the United States, or very close to the top. Synthroid particularly, or levothyroxine. So some of the things when we're looking at the whole person and not just the parts, we want to look at all the symptoms in the entire body. Even if someone has fairly classic low or over-functioning thyroid symptoms, we still want to look at the whole body, every part, mental, emotional, and physical. Diet and lifestyle are very important when it comes to looking at things that might be in the way, because removing obstacles first is always the best way to start. We want to see what's in the way, whether it's one of our habits, food we're eating, overgrowth in the gut, whatever it is. We want to remove that, get it out of the way so that the body can function a little bit better. And then if any systems in the body have already been irritated or damaged or inflamed, we want to support those through various means, through diet, through supplementation, nutrients. And then we want to add things, the things that we add, we want to only add what's needed to help support the body, the parts that have been inflamed and damaged, and maybe to resupply nutrients that we might be low on. And anything that we add is a supplement, and supplements are named as such because they're not meant to replace things forever. They're meant to supplement your diet or your lifestyle to give you what you're missing temporarily. But hopefully, if we're really correcting at the source what's going wrong, those things will just be temporary. And then a nice little reminder that food is always your best source of nutrients if you're absorbing things well. And if not, then that might be part of what needs to be improved. So getting into the actual hormones themselves, the HPA axis is a symphony of all the different hormones. We're only going to talk about a few. I'm only going to touch on this pretty briefly. But the HPA axis stands for hypothalamic pituitary adrenal axis. And the hypothalamus is in the brain. And you can see right up there that stress is at the top. And so any stress could be mental, emotional, physical stress. The body does not differentiate stress, one kind of stress from another. It's just varying degrees. So if there's any kind of stress on the system, that little bit in the brain produces a hormone called CRH. That goes down to the pituitary, which makes it produce another substance called ACTH, so on and so forth. The outpour is cortisol, which when you're really stressed out, your body might produce excess cortisol for a period of time until it wears out. And then when it can no longer do that, it becomes fatigued and your cortisol levels drop or become depressed. And you can see there are feedback loops, those negative feedback loops that just show, without getting into too much detail, just show that it's all very interconnected. So when there's too much of one thing, it's going to downregulate one part or upregulate another. So you can't take one piece without the others. And I just thought this was funny. So, and we'll get back to how this relates to the thyroid, but because the adrenal system really is our energy system and our anti-inflammatory system, it has a lot to do with how well the thyroid produces hormone and then takes that hormone and makes it active. So this just shows in a really funny way that how those hormones are produced. You know, when you're super stressed out and then cortisol comes in and tries to dampen the day and say, hey, shut up, I'm trying to get some stuff done. And then it can only do that for so long, and then it becomes worn out. And you might, over there on the right too, it says cortisol raises glucose levels. So there can be troubles with blood sugar over time with thyroid and adrenal dysfunction. And sometimes that will show up first. So these are kind of the classic symptoms that hypo or underfunctioning thyroid. On a lab test, you would see high TSH, and we're going to look at the other numbers as well, but even conventional doctors, most everyone tests for TSH, thyroid stimulating hormone. Weight gain, hair loss, fatigue, feeling cold all the time, mood changes that are more in the depressed and lack of motivation, kind of feeling down, heavy, sadness, and a lot of difficulty concentrating with brain fog, feeling like the brain is too slow or there's something in the way. This is the most common form of thyroid dysfunction and the thing that gets treated most, but hyperthyroidism is a thing, just way less common, and it would be the opposite for the most part. You would see low TSH on lab test, weight loss, rapid heart rate, things that look like panic attacks or anxiety attacks, feeling really revved up and racing, inability to sleep. The mood changes tend to be more on the irritability side, kind of manic, hyperactive, anxiety. And there's also difficulty concentrating, but it's the type of where you just can't focus your brain on one thing because there's so much going on at any given time. This type of overactive thyroid is usually treated with radiation or surgery. There are some medications, but it's considered, at least conventionally, harder to treat than low thyroid and less common. And then Hashimoto's. So probably a lot of you, and I'll be curious if people want to share at the end, a lot of people have been diagnosed with Hashimoto's. It is, if you look it up on the internet, it'll say it's the #1 reason for hypothyroidism. And that's true to a degree. Originally, Hashimoto's thyroiditis meant an actual swollen thyroid gland that was full of nodules, inflamed, and that you had positive thyroid antibodies. But nowadays, most people just get diagnosed with Hashimoto's without ever doing a thyroid ultrasound, without ever looking at thyroid antibodies. It's just assumed that if someone's TSH is high, that they have Hashimoto's. There's really no harm, I guess, in doing that, other than it's just a little confusing to people sometimes what it actually means. Hashimoto's is an autoimmune condition, whereas just traditional old school hypothyroidism is not considered autoimmune. And I think because we know now that so much of thyroid dysfunction is autoimmunity, that they've just sort of made the leap most times that most people with low thyroid function have Hashimoto's. Or I would argue they have an autoimmune condition, maybe not true Hashimoto's. And almost always when there's an autoimmune issue going on anywhere in the body, thyroid or otherwise, there's almost always some part of that that's related to gut function. So this is really my wheelhouse. I do a lot of gut treatment. Well, I end up treating a lot of these things, but a lot of it comes back to the gut. So I end up treating a lot of gut dysfunction. And there's so much out there on gut dysfunction. And so I want to relate it back to thyroid and adrenal glands particularly today and give you a little bit more information, because a lot of people will say, my gut is fine, you know, I poop every day, I don't have diarrhea, I don't have abdominal pain, you know, nothing severe, so everything's fine, right? Well, maybe. Sometimes these things can be a little bit more silent. So there's good bugs we've all heard about, there's bad bugs, and then there's a lot of in between. There's a lot of gray area of opportunistic bugs that might be normal, but they can also overgrow and cause us to have a lot of problems breaking down hormones, turning hormones into active forms, all kinds of things. So I always like to start this part off with the poop chart because this is one way that you can quickly see. This stool chart comes from Bristol, England. Bristol, England's probably the most famous thing about it. And what you really want is type 3 or 4. Anything other than 3 or 4 or alternating back and forth, changing here and there, not going every day, every few days is abnormal. And there's probably some more investigating that you could do to figure out why things aren't quite as optimal as you might like them to be. So that's the first thing. Always look, check and see what things look like. See if things, people do this with their kids a lot, but then as when we get to adults, you know, you're always looking at your kids' poop, but then we don't always do it for ourselves. So don't forget. So in a very simple way to start off, the gut-thyroid connection, one of the simplest things that probably a lot of you have heard of is that the gluten molecule, which is a really large molecule, looks a lot like thyroid hormone. Or thyroid gland. And if you have leaky gut, which means the little spaces between the cells in your small intestine lining become a little bit less discretionary about what they let pass through. You've got guards that allow things to come and go between the gut and the bloodstream, which is normal, but they start to not keep tabs quite as well, and they start to let a lot of things through. And if that large gluten molecule happens to get into the bloodstream, the body will think it's a foreign invader and make antibodies against it. If that continues for a long period of time, or you just happen to have an innate sensitivity, the body can become confused, the immune system can become confused and start to make antibodies to itself, and particularly to the thyroid gland. Your body can also start to make antibodies to any other tissue in the body that it might get confused about. It's just that the thyroid and gluten connection has been demonstrated over and over again. So that's always one thing that you want to avoid if you know you have thyroid dysfunction. And then nutrient depletion also happens when you have leaky gut and you're not able to absorb your nutrients well. Maybe your food's not getting broken down well above the small intestine, and so the pieces that are left behind that should be small enough to absorb are too big, and so they just pass through, or they're not absorbed well enough because of leaky gut. And then that nutrient depletion can also lead to depletion in hormones. The body has to use a lot of nutrients and a lot of energy to make hormones. All hormones are made on a cholesterol backbone, and they're made and broken down in the liver. So there are a lot of pieces to that puzzle, and if you're missing the main ingredients or those base nutrients that you need, your body's just not going to have enough raw material to make the hormones that it needs. So that could be part of the problem. And then overall inflammation, if there's something wrong with the gut lining, whether it's an overgrowth of bacteria and or leaky gut, food sensitivities, that chronic low-grade inflammation is going to be keeping the immune system busy constantly. The immune system is going to be trying its very best to correct that inflammation, and usually it can't because there's something in the way. And then that leads to what I mentioned before, leads to immune confusion, which can turn into an autoimmune condition, among other things. So when the gut is happy, the thyroid is happy. So some of the, and we're going to look at this in a minute a little bit more specifically about what things you want to look at on a full thyroid panel. But T3 and T4 are two of the hormones produced. T4 is produced by the thyroid gland, and then one arm is cleaved off in the bloodstream and turns into T3. Both of them float around, and they both have mechanisms that help protect your gut lining from becoming leaky. But that goes both ways. If the gut is already inflamed, it can also impair how much T3 and T4 are being made. TSH, the thyroid stimulating hormone that comes down from the pituitary gland, increases our immune function in the gut gut-associated lymphatic tissue, and it lowers inflammation. And then if we have good, healthy gut flora, like all the right kinds and the right numbers, then that really helps with the conversion of T4 to T3, and you're going to have more active hormone. And it's that active hormone that actually floats around the body, all over the body, not just the thyroid gland, and does things. It's like the key that makes a lot of different processes in the body work. So healthy gut, happy thyroid. Unhealthy gut, unhappy thyroid. So if you have unhealthy gut for whatever reason, the toxins from all of the quote unquote bad gut bacteria, and I put that in quotes because bad often implies that it shouldn't be there, and that's not always the case. Sometimes it should be there, it just shouldn't be so abundant. So whatever's there that's just out of proportion can decrease thyroid levels overall, both T3 and T4. It can dull receptors all over the body, so it makes all the receptors less sensitive to the active T3 that's floating around. It increases inactive T3, so there are a couple different sub-steps before you get to the full T3, but they don't do anything. They look similar, but they don't actually do anything in the body. So it can increase the number of those. It decreases TSH, so you don't get that feedback loop to the thyroid gland. And it can promote autoimmune thyroid disease in the way that I just mentioned, where the immune system can become confused and start to make antibodies to the thyroid gland. So if there are things that we find, and we're going to talk in a minute about specific tests that are out there and what they're good for. If you find things that might be part of the thyroid and adrenal picture, you want to clean out any and all overgrowth. So yeast, parasites, and bacteria can all play a part in that. So you do your best to find what's there and then clean it out. Once it's cleaned out, at least you think it is, then you start to repair the inflammatory damage that's been done to the lining. And that can be done in a lot of ways, but definitely with diet, herbs, and targeted supplements. And then you want to replenish. So you've gotten rid of that inflammation, you've gotten rid of the overgrowth, and then you want to really nourish and help your body rebuild good lining in the small intestine. And so you want to help repopulate the microbiome with proper probiotics, proper diet for you, which will vary from person to person, rest and exercise. So then we talk about testing and treatment. So what's really going on and how to treat it? Often people come to me already diagnosed with hypothyroid. In fact, I'd say most people do. I very rarely am the person that's diagnosing that. Most of the women I treat come already on thyroid medication. And sometimes they show up because their thyroid medication doesn't feel like it's working anymore, or they have to keep increasing the dose, or their thyroid numbers are never quite right. So especially when that's the case, or even better, best case scenario is before that even happens, at the very first sign of decreased thyroid function, what can you test? How can you really look deeper to see what's going on and maybe prevent the need for medication or lower the dose? And the big key is TSH is not the whole story. So TSH is only one molecule in this whole symphony of how the thyroid gland communicates with the rest of the body. It is turned on or it goes up if the thyroid levels drop. So the pituitary gland sends out a message and says, hey, thyroid gland, you're getting lazy, you're laying down on the job, you got to start making more thyroid hormone. In a healthy system, the thyroid gland says, oh, sorry, yep, you're right, pump out some more T4, the body converts it to T3, that feeds back to the pituitary says, thank you, okay, you did the job, all is well and good. But if for whatever reason the thyroid gland is not able to respond, the pituitary gland just keeps trying. It keeps pumping out more and more and more TSH, even though there's no response. And so you'll see TSH go very high when thyroid is very low. But people can have thyroid symptoms, all those low thyroid symptoms we looked at earlier, particularly, I think, weight gain and brain fog, hair loss. Those are all really big ones that people complain about. They can have all of those and their numbers can look normal, or the TSH will be normal and their doctor will say you're fine. But then if we look at a full thyroid panel, which would include TSH, free T3, free T4, so not bound to proteins, but actually floating around kind of ready to do their job, TPO or thyroperoxidase antibodies, and TGA or thyroglobulin antibodies, which look at antibodies to different parts of the thyroid gland. And then I sometimes run reverse T3, sometimes not. Reverse T3 is one of the inactive forms of T3, and I've heard reverse T3 explained sometimes as the junk pile. Like if the body is not, it's producing too much T3, or the T3 is becoming inactivated because of gut microbes, it needs sort of a garbage dump to throw it into. So it turns it into this form of T3 that's not active, but it does float around and get in the way of thyroid function. So this is at the minimum. There are other thyroid markers, but at the minimum, if you really want to know what's going on with your thyroid, you need to run all of these numbers. And then some other tests to consider. So if you think about those common symptoms of hypothyroidism, you know, fatigue, weight gain, you can have insomnia, hair loss, brain fog. Those symptoms are very vague, and they can look like and be parts of a lot of other things. So if someone has never had a comprehensive stool analysis done, I almost always start there. Even if people think that their bowel habits are normal and their digestion is normal, although once I start asking questions, almost everyone realizes that things could be better. And if there's anything on stool analysis, we start there. Depending on the person, mold exposure and a sensitivity to mold, which I think Alexis and I can both attest to personally, I would run a mycotoxin panel, or there's some blood markers that can look for mold exposure. This can be mixed with yeast overgrowth in the gut, also produces mycotoxins, and mycotoxins can mimic a lot of the symptoms of hypothyroid. They can also affect the thyroid gland directly. A full adrenal hormone panel, which I usually do as a saliva test, can also be a good adjunct, especially when there's anxiety, depression, or insomnia, or all of the above, because then we can see if the adrenal gland really is part of the problem. For example, if your adrenal hormone cortisol is too high, your body won't make that conversion from T4 to T3 very well. And so your T4 might look moderately high, but your T3 will be borderline low. So that's often a really good start. And if someone's never had one for women, I think they're also really helpful to look at female hormones and how those interrelate as well, because progesterone and cortisol share a common pathway. Lyme and co-infections also the great mimicker can look like all of this and can be part of it. So people with Lyme and co-infections have to be tired. If you're not fatigued, you probably don't have Lyme, but if you're fatigued and you've got a lot of these other symptoms and you have potential history, which if you grew up in the Bay Area, you have had potential exposure, it may be worth ruling out, but you have to go to a Lyme literate doc that can tell you whether or not they think that that's necessary. And then viruses, also EBV, CMV, HHV6 are three of the common ones I run. When people have high antibodies to these, because these are things we've all been exposed to, that shows that the immune system is struggling. It won't tell us, the viruses themselves are rarely the actual problem, but it will give us a picture or a window into what's going on in the immune system and might point you toward Lyme disease or other chronic infections that might be in the way. Mycoplasma pneumoniae is another one that I see a lot of. And then, of course, the good old food allergy panel, which there are a bazillion of them out there. They're all slightly different. I put this at the bottom because I don't often start there. Food allergies are created. You're not born with them typically, not these kind of food allergies. And so finding out what's in the way in the gut is usually more effective. And then if foods are still really a problem, I run food allergy panels later in the game. And then just a basic thyroid nutrients and support. You want to make sure that your adrenals are healthy, that you have good stress management, which is going to help with that, and regular rest, sleep, both regular rest and restful sleep and downtime. So some time spent doing nothing, which I know is hard for most of us to imagine, but downtime is also important. Healthy gut, like we've talked about, and then the basic nutrients that, you know, you can just look on the internet, and this is probably a handful of them that will come up: iodine, B vitamins, selenium, zinc, and vitamin D. And a lot of people will, you know, race out to get these and take them all individually. And what I would say, rather than doing that, is look at why those nutrients are low, if they are, and just try to take them in a way that you're taking less pills if you need them all, or figure out which ones you might need more than others. Too many supplements can also be really hard on the digestive system. These are the foods that if you do innately have a tendency towards low thyroid, any raw cruciferous vegetables, so kale, cabbage, broccoli, and cauliflower, there's others, but those are the most common. I don't think anyone should ever eat raw kale. I know I'm in the minority probably in the world in Marin, but it can actually, I've seen people actually develop clinical low thyroid from eating too much raw kale. Millet has a particular thing in it that lowers thyroid function. Soy, I would say non-fermented soy, so fermented soy is better, and gluten. These all lower thyroid function directly, not because of a food allergy. And then how to really love your thyroid and your adrenal glands. So this is what anyone can do if you're feeling tired, if you feel like or you know that you have any thyroid or adrenal issues. Schedule and regularity are the most important. Sleep and eat meals at the same time every day, even on weekends. Eat whole organic, non-processed foods. Try to stay away from sugar and processed carbs. Eat lots of good fats, which in my book is grass-fed butter and ghee, olive oil, and coconut oil. Rest and decrease your stress as much as you can, or find ways to manage it that work for you. And then exercise to your capacity. So exercise to the point that you feel good afterward. You don't feel like sleeping. You don't feel terrible the next day. You don't feel excessively sore for 2 days after. So really finding exercise that invigorates you and makes you feel better, both in the short term and the long term. And then just quick review of all of this. When you're looking at the thyroid puzzle and you think it might be thyroid, don't get too narrow focused. Look at all the symptoms in the body and mind. And I think Alexis is probably going to go into this because this is very much from my homeopathic training, that body, mind, and are all connected, and you really want to look at everything. But especially as far as the body's concerned, you want to look at hormones, immune system, and digestive system in whatever questioning and testing that you need to do. And then run all the relevant tests, not just TSH, look at other parts of the body and try to find any underlying causes that might be inhibiting thyroid function. And then remove obstacles to cure. This is the biggest one. So remove things that are in the way first, which could be chronic infections, irritating foods, bad habits. And then you see what's left. Once you've removed everything you can, then you see what's left and you go from there. And remember, you're not a car broken up into pieces. So don't assume that thyroid medication is the only option or that it must be taken forever, because I have seen the thyroid gland repair itself happily when given the right circumstances. So that's the end for me, quick and sweet. And I wanted to end with a homeopathy quote, because this is probably the most famous quote from Hahnemann. The very beginning of his Organon of Medicine, the physician's high and only mission is to restore the sick to health, to cure, as it is termed. And I think that's what we're always trying to do to the best of our ability, is get everything out of the way that we possibly can, give the body what it needs to heal, and then stand back and help only when we really need to. So on that note, I am going to pass it back over to Alexis.
Well, thank you very much. That was a beautiful presentation and transition into homeopathy. Should we take all the questions at the end?
Yeah.
Okay, we'll take all the questions at the end. Just remember, everyone, to write your questions down. And then at the end, if you have a question, just put your name in the chat, and then we'll call on you to ask your question, because it can get a little confusing with people talking all at once on Zoom. And Audrey asked, can we get a copy of the slides?
This is going to be recorded, so I'm going to send out an email to everyone that I emailed the link to today, and you will get a copy of the recording. So the slides will be in the recording as we've presented them.
Okay, got it. You can have a copy of my slides. I could send a PDF if you want. You haven't seen my slides yet, so we'll see.
Oh yeah, I can send PDFs too, but you will all get a recording.
Okay, good, wonderful. Okay, so I'm going to start. I'm going to share my screen. Share away. Okay, good. So here we are. I'm going to see if it works for me to just do it like a slideshow. Let's see. So this is, I am Alexis White. I have a women's health and family practice in San Anselmo, and I do treat thyroid dysfunction as well as many, many other things, but that's what we're talking about tonight. So we're going to start with a brief overview of homeopathy, since some of you may not know exactly what it is. And so if you do know what it is, it's just a nice refresher. So homeopathy is a specific modality or branch of alternative medicine. And the remedies that are made, the homeopathic remedies, are formulated in a specific homeopathic way. So that is different from herbs, it's different from any other kind of supplement. So it is really its own branch of medicine with homeopathic remedies. There are over 3,000 different discrete homeopathic remedies, but you may have heard of arnica, which is the most popular remedy that everyone has heard of. And what makes homeopathy unique as a practice and a system is that remedies that you need are chosen for you based on your unique symptoms. So it's a little bit of the opposite of going to the allopathic doctor, where anybody with strep throat might go and get a Z-Pak or azithromycin or an antibiotic, and anyone could have that antibiotic. In homeopathy, if 10 people came to me with strep throat, I would take their unique case and I would give them a remedy based on their unique expression of their symptoms. So it's a little bit of an opposite way of looking at case taking and treatment. It is energetic medicine. It's minute diluted doses. That's the homeopathic preparation. And because it's energetic, it works differently in your body, as opposed to, it stimulates your vitality, your body systems to return to health, to be restored back to balance, as opposed to something like an antibiotic, which is a material substance that goes in your body and kills bacteria. This is not material in that same way. And so because of that, it's very gentle. It has no side effects, and it's safe for all ages and all conditions. Everything from babies to grandma, in any condition, can take homeopathic remedies safely. It's effective, it's inexpensive, it's non-toxic, it's green medicine, and it's widely available at health food stores and online. And practicing it is based on simple principles. And the principle is this: it's based on a principle first observed and documented in 400 BC by Paracelsus, and we call it the law of similars. And the law of similars states, like cures like. And what that means in practical terms is that we want to match a patient's symptoms to the known symptoms of a remedy. So we want the symptoms that the patient has and the symptoms of the remedy to be alike. And so here's an example. I think everyone can relate to what it's like to get a bee sting. I think probably everyone's had a bee sting. We all know that a bee sting has the following things in common. It's red. Here's a picture of a bee sting for you. It's red, it's hot, it's swollen, and it's got stinging, burning pain. Now, it might have other things too, but those are some very common symptoms. So if someone gets a bee sting, my job would be to find a remedy with those symptoms, and the symptoms of the bee sting will be neutralized. So we look here at this remedy called Apis. And this is an extract, an excerpt from my Materia Medica. This is the exact wording that came from the Materia Medica that tells us that Apis mellifica has these symptoms: swellings after bites or stings, stinging pain, hives, burning, stinging, itching, redness of skin with sensitivity, edematous swellings, which is with fluid, and it's a specific for insect stings or bites. So we can see that the symptoms of the bee sting and the symptoms of the remedy are alike. And so when we give the remedy Apis to a person who's had a bee sting, it relieves the pain, swelling, and redness in a few minutes. And that's the essential principle of like cures like, and it's what we have built all of the homeopathic practice on. So a bee sting is, of course, an acute condition, and acute conditions or illnesses arise and resolve in a short time. That's a definition of an acute illness. And homeopathy can be used effectively and easily by anyone in acute situations, as long as they have a little training and the tools needed. Maybe some of you have learned some of that. I know that I see some familiar faces here today who have taken some classes with me, and it really is possible for anyone to learn it and apply it at home with your family. But what about the conditions that arise and don't resolve quickly? Conditions that stay for months or years, or things that we're born with and are with us today. So these are chronic problems. And homeopathy's role in the resolution of these kind of chronic problems is to restore harmony and balance to the whole person. Just like Sangeeta was saying earlier, the mind, the body, and the spirit. Homeopathy is whole person medicine. We never just look at the one part and say, okay, let me just look only at your leg and I will only treat your leg. We're treating everything. And so chronic cases are treated using the same principle of like cures like. And when we're treating chronic disease, it's best to work with a professional. So in acute situations, you can learn how to do it at home. Treat the flu, treat diarrhea and vomiting, treat bee stings, treat injuries and accidents. But when you're treating chronics, it's best to work with a professional homeopath rather than trying to treat yourself. Whenever I teach this, what ends up happening is that my list of chronic things is always much longer than the list of acute things. So here's an example. So an example list: menstrual pain, menopause symptoms, migraines, allergies, asthma, eczema, psoriasis, recurrent infections of any kind in any location, chronic pain, IBS and GI dysfunction, sleep disorders, mood swings, depression, anxiety, panic attacks, anger issues, low self-worth, night terrors, persistent thoughts, fears, grief, delayed development, etc. These are all chronic issues. And this is just, of course, a short list. I didn't have enough space for every chronic issue. These are all things that I've treated successfully with homeopathy, but you do need to come to a homeopath to treat them. And so tonight's area of discussion for chronic care is thyroid dysfunction. Thyroid dysfunction is a chronic condition. It does not fit into the definition of arising and resolving in a short period of time. It's something actually that kind of creeps up slowly and then ends up lasting a really long time unless you do something about it. And so tonight's purpose is not to tell you what you can do, like here's a remedy for you, but more to give you inspiration and hope to answer your questions about homeopathy and thyroid dysfunction, and to help you get motivation to move your health forward. Sometimes people need a lot of motivation to change their diet, for example, or change their habits. One of the hardest things I find to talk to my clients about, or for my clients to receive from me, is for me to tell them to stop eating gluten or to meditate. These things are much harder than doing other things. And so maybe this will help you find the motivation to make a change that will help move your health forward. And it will show you the power of homeopathy to change your health and your life. Because we really are treating the whole person. You don't just treat the thyroid gland, you're also treating everything else and bringing everything back into balance. So this is how homeopathic treatment supports thyroid health. Of course, we're supporting whole body health, mental, emotional health, and homeopathic treatment supports the thyroid directly and can restore normal function. As we've already gone over this with Sangeeta, but you have hypothyroidism with underactive thyroid, hyperthyroidism with an overactive thyroid, and then you have an autoimmune disease. And again, you've already seen this. My list is a little bit longer than Sangeeta's. These are classic hypothyroid symptoms. People don't tend to have them all, but if the more you have, the more likely it is a thyroid problem. Of course, you can have anxiety that has nothing to do with your thyroid. It can be, so it's a way to see if I have 10 of these symptoms, that's pointing strongly at a potential thyroid dysfunction. Here are classic hyperthyroid symptoms, which is pretty much the opposite. Instead of being slowed down, it's very revved up. weight loss, irregular heartbeat, increased appetite, tremor, nervousness, anxiety, and so forth. This is something I don't see as much as I see hypothyroid. The hypothyroidism is extremely common. So my job really is to find the right homeopathic remedy for you and your thyroid symptoms. It's all mixed together. It could be hypothyroid, hyperthyroid, and or with autoimmune disease mixed in. So this is what I have here. I can't use my cursor to point it out to you, but what you can see is this long list of remedies. And in the top left corner there, you can see generalities, weariness. This is a rubric that comes from my homeopathic book that tells me for this symptom of fatigue up in the upper left-hand corner, there are 721 remedies that have the symptom of fatigue. And that means that there are a lot to choose from. And your remedy, if you have fatigue, is probably in there, but that's a lot. So that's a really big rubric. And what we'll see is that as we go down this list, you'll see that there are hundreds and hundreds of remedies in these rubrics. So many remedies for me to choose from to find exactly the right remedy for you. We've got heavy menses here. Menses is your menstrual period, profuse menses. We've got 445 remedies to choose from. And one of those is going to be right for you if that's your symptom. Hair falling out, that's a very common one that I see. Slowed heart rate, depression, here we have 903 remedies. So this is a way of just showing you that there are so many remedies that can treat these things. However, of course, we are really looking to find the right homeopathic remedy for you, because each person is in their unique state, which is made up of the totality of their symptoms. It's like a constellation that's made up of stars. Each constellation is a unique pattern, and your symptoms are the stars of your constellation that makes up you. So in the consult, we look for everything that contributes to your overall state, your mental, emotional, and physical symptoms. And when we find that totality, then we're finding your constellation, and we can find the remedy that matches you the best. So for example, let's say you do have Hashimoto's, and over on the left, you see this list. You've got dry skin, elevated cholesterol, you've got heavy periods, brain fog, and you have an enlarged, swollen, inflamed thyroid gland. But you are also overly responsible, fastidious and orderly, you like to stay busy, you've got to exercise or else, you've got cold sores, heavy periods with clotting, and you've got Hashimoto's. So then we're looking at your mental emotional symptoms. We're looking at what makes you feel better, what must you have, what kinds of things you avoid, and we're looking at your physical symptoms. And so then we come up with something like this. This is called a repertorization chart, where I've put in all the symptoms there on the left, and that represents the totality of you and your symptoms, just like you, the constellation. And then on the top, what we see are the remedies for me to begin researching. What might be right for you? Look, there's Natrum Muriaticum is the first one, and then Lycopodium and Sepia, Calcarea Carbonica, carcinosin. And then I have a place to begin to start looking for a remedy that would match you. But when I think of thyroid dysfunction, there's a short list of remedies that I often consider that frequently have thyroid dysfunction as a part of the picture. And that's Sepia, Natrum Muriaticum, Calc Carb, or Calcarea Carbonicum, carcinosin, Iodium, Lachesis, Belladonna, Carbonicum, and Spongia. Interestingly, many of these remedies come from the ocean. Sepia is a cuttlefish, and Natrum Muriaticum is salt. That's just a fancy way of saying sodium chloride. Calcarea Carbonicum comes from the inner lining of an oyster. And then Spongia is actually a sea sponge, that the living creature, the sponge. So the point is that maybe your remedy is not on this list, but that there is a remedy that's just for you, that will bring you back into balance and restore health, including your thyroid, because your thyroid is just part of the greater system of you. So I was going to tell you a little bit about 3 of these remedies that I find very commonly treat thyroid issues. And the reason that I want to tell you about them is I want you to appreciate the fully fleshed out nature of these remedies, that they have lots and lots of mental, emotional symptoms, lots and lots of physical symptoms, and that they almost come to life like a character who comes to life. And so as I start to describe it, maybe you'll say to yourself, oh, wow, that sounds like me, or wow, that sounds like my mother, or that sounds like this friend of mine, or maybe it sounds like, Woody Allen, who's a little bit neurotic. And, so you can see that they are fully fleshed out characters. So this is Natrum Muriaticum, the salt, sodium chloride. And the mental state of Natrum Muriaticum is a very responsible and dignified person who is very affected by grief, loss, and disappointment. And this, of course, can lead to a depressed state in which the Natrum Muriaticum person dwells on past griefs and humiliations. And so there's a lot of rumination, thinking about things that happened in the past that were not the way she wanted it. And so, of course, there's grudge holding and thinking about how people wronged her. She tends to be serious, proper, and responsible, easily offended or wounded, and greatly affected by embarrassment. Fastidious, perfectionistic, on time, and can be hypochondriacal. They often fear robbers or someone breaking into the house because this is a kind of feeling of lack of safety and security, that you can't protect yourself. Also fear of the dark and claustrophobia. And I'm just going to take a moment and say that a person who needs Natrum Muriaticum might not have every single symptom that I'm mentioning. This is sort of the fleshed out picture. And then what I'll find is that someone might have 50, 60, 70% of the symptoms of Natrum Muriaticum. This is the general mental state. The physical symptoms of Natrum Muriaticum run the gamut. There can really be in any system, but it's very well known for headaches, especially extremely severe migraines that feel like hammers beating the head. And they are worse from light, sun, reading, noise, and the period. They get cold sores and canker sores. They have hay fever with mucus like egg white, premenstrual syndrome with irritability and sadness, back pain, insomnia, especially from thoughts of grief or dwelling on these disagreeable things that they dwell on in the daytime too. Colitis with sudden urging and diarrhea for stool, sudden urging for stool. Bashful kidneys, and what that means is that feeling of embarrassment that we mentioned in the mental state. There's a feeling of embarrassment about urination, so they cannot urinate in public, or so they can't go in a public bathroom, or if anybody else is nearby and might hear. And there is stress incontinence, which is involuntary urination. Vaginal dryness and aversion to sex. And of course, hypothyroidism, hyperthyroidism, especially if it comes on after grief. We see a lot of things arise after serious mental, emotional issues, grief, trauma, physical symptoms can arise after that, and it can be very telling for us as homeopaths about what remedy a person needs. The next remedy we're going to talk about is Sepia. Sepia is the cuttlefish. I tried to find a really cute picture of a cuttlefish, and that's our Monterey Bay Aquarium cuttlefish. So Sepia is a very, very common remedy that I prescribe. This is a really sensitive person who has become overwhelmed by the demands of motherhood and compensates by building a wall around herself. Oftentimes, a sepia girl is very different from a sepia mother. Motherhood and hormones often really shift that sepia state from kind of happy-go-lucky, life of the party, sensitive and fun, into really tripping into being overwhelmed because of that sensitivity. they get overwhelmed by those demands. So they become very irritable and overwhelmed, angry and yelling at the least disturbance, especially at the children, feeling disconnected and indifferent to their family, even angry and averse to them. They can make mean, sarcastic, cutting remarks that cut right to the quick. I often hear people say, you know, I don't want to say these things, but I can't help myself. I can't stop myself. And it's a really can be a quite desperate state. She hates that she does it, but she can't help herself. There's a deep desire to be alone. This is the response to feeling so overwhelmed and like everyone is nursing and everyone is clinging to me, and I just want to be alone. And I want to keep busy and occupied. This is not a person who wants to lie around or meditate. So they are better from and have a need for really vigorous exercise. So this is where I see marathon runners or people who ride mountain bike for 30, 40 miles, because there is this desire for physical and mental stimulation. It's that exercise, as well as a love of dancing, a love of the excitement of thunderstorms. This is what we see, that like, this is how I get excited again about life. And she just wants her body to herself. So no sex, please. Everyone's been nursing and clinging on me all day. No way. That's where the wall comes in. In fact, I don't know if you guys know about this blog called Scary Mommy, but I think it's funny. It's sort of satirical. And I got an article one time that was written in the voice of a woman who clearly needed sepia. And it even came down to, like, I get into bed and my husband reaches over and I say no, and I put up a wall of pillows between me and my husband. And I thought, oh my gosh. So I wrote a blog myself referencing this Scary Mommy blog about sepia. And you can read it if you like on my website, on my Notes from Alexis page, because it's just such a desperate state of overwhelm. The physical symptoms of sepia, a lot of PMS with irritability, depression, weeping, vaginitis and yeast infections with white discharges, sore breasts, painful sex, menstrual pain, especially cramps that feel heavy and pushing down, like I have to cross my legs or my uterus will fall out. The period can come too early, be too profuse, too prolonged. There can be bleeding between the periods, hot flashes with excessive perspiration, stress incontinence with sneezing, coughing, and jumping on a trampoline. Anyone who's had a baby, I don't know how they can jump on a trampoline anyway. Very affected by normal hormonal changes. And that's why motherhood is such a changing point, because you have the tremendous hormonal changes when you're pregnant and after you have your baby, and those really are difficult to absorb and get accustomed to. And those are normal hormone changes, but there can also be ailments from artificial hormones like the birth control pill or hormonal creams, hormonal IUD. And I've seen a lot of girls who have trouble with that from taking those hormonal birth control. There can be Raynaud's syndrome, where your hands get very cold and turn white in the cold. Skin eruptions like psoriasis, vitiligo, and eczema. This is a wonderful remedy for morning sickness. And of course, thyroid nodules and hypothyroidism with a feeling of being really cold, constipation, and sallow skin. So you can see it's a wonderful women's remedy. I mostly give it to women. Sometimes men get it too. This is calc carb. This is the inner lining of the oyster shell, which is made mostly of calcium. So the calc carb mental state is a person who is overworked, overburdened, and overwhelmed. There is this strong sense of duty and responsibility, which causes worry and stress. They're worried about all these responsibilities and duties. And then they can go into a depression in which they lose interest in their work. They're very hard workers, but when they start to slip into a depression, they can start to feel despairing and start to lose interest in that. I find calc carb to be very sensitive to hearing bad news or or actually even watching the news. The news is mostly bad news, so maybe that's why. But also it can be watching scary movies, disturbing movies, violent movies, anything where that really makes them feel really terrible inside, and it's hard for them to let that go. It's as if they really absorb all that negative energy. Preoccupation with metaphysical concerns such as life after death, reincarnation. I see a lot of kids in this state, kids who are overly preoccupied, what's going to happen after I die, and so forth. I call them the big questions that kids who are 5 and 6 years old shouldn't really be thinking about. Apprehensive and anxious, feels that his mind is weak or he may go insane, and others can perceive this confusion. Many fears of so many things: mice, rats, heights, the dark, claustrophobia, health, anxiety about health. And this remedy can have nightmares or night terrors at any age. The physical symptoms of Calcarea are vertigo. And when I have this short list here, but there are thousands of symptoms for calc, but I picked these as really keynote symptoms. Perspiration on the head, especially during sleep, migraine headaches, acne, tinnitus with or without vertigo, chronic nasal obstruction. There are a lot of chronic infections in this remedy, like a low immunity where frequent chronic infections, ear infections, sinus infections, respiratory infections. So you've got nasal obstruction with hay fever, swollen, painful breasts before the period, back weakness and low back pain, and lots of skin conditions, everything, boils, abscesses, eczema, psoriasis, warts, cracking, especially cracking of the tips of the fingers, indigestion and heartburn, constipation is a really big one, fibroids, menstrual period can be too early, too profuse, too long, chilly and worse from cold, and then goiter and hypothyroid conditions. So I have here a case to share with you of a 43-year-old woman with thyroid dysfunction and a goiter, which is kind of unusual to see a goiter in this day and age. So this woman came in with a chief complaint of brain fog and difficulty concentrating. And she said that she had neurological symptoms, which I put in quotes because I'm not really sure that they were neurological, but that's what she called them. So we're going to say that she had neurological symptoms, which included having a feeling of being drunk, even though she wasn't drunk, a feeling of being out of her body, and a feeling that her head and limbs felt really heavy. And these symptoms she thinks came on during her vacation, but she's a very busy person, so maybe they came on sooner. So that was hard for her to tell me. But she has some extreme stress events in her recent past. Her father died. Her mother is sick with cancer. She has a stressful marriage. She has an abusive ex-husband who also has a terminal disease, and she has a toxic job. So these are all, just like Sangeeta was talking about, the level of stress and how that affects us. It affects our gut, it affects our hormones. And so all of those things could have contributed to ongoing dysfunction and inflammation. She says she's a control freak. She said those words. That's why they're in quotes. She desires stimulation. She's very busy and fills her calendar with social events and doing things almost every night. She prefers to be in control of the plans and the execution of the plans, so things are, quote, done right. She's highly annoyed by clutter and disarray in her house, and she's better with intense exercise and sweating. And like a hot, cold plunge, roller coasters, thriller, horror movies, and thunderstorms. So you see that desire for stimulation. And she is very social. She has anxiety about her health, which borders on the hypochondriacal. She told me she feared her daughter had leprosy when she had a staph infection. She fears the staph may be in her brain from swimming in a murky lake. She's fixated on her fears that she may end up with Alzheimer's like her father. And she's very aggravated from being told no. And this triggers in her a kind of self-injurious rebelliousness. For example, she might do something radical that ends up hurting her, but just to prove the point that she's in control of her own life. She has a goiter, which is the swollen, inflamed thyroid gland. I don't know if you can see me. I see Sangeeta, but I don't know if you can see me. I'm pointing at my throat. She has a long history of high TSH and low T3, but this is just a classic symptom. Not a symptom, a problem. Her doctor didn't recommend any treatment, so she's not taking any medication. I see this a lot where doctors look at the high TSH and they don't recommend anything. So people don't do anything. They don't even make any lifestyle changes. And if you don't make any changes at all, it's just going to continue on in that way, especially with this level of stress that this woman has. She has low ferritin. Those are your iron stores. She has polycystic ovarian syndrome, another hormonal issue. She's got low libido, and she has stringy coagulated bleeding during her menstrual period. So what did I do? I created this rubric chart for her, just like I showed you before. This is the actual chart that I pulled right out of my computer, where you can see that I created a rubric here to be busy. She desires stimulation, anxiety about her health, a goiter and thyroid disease, difficult concentration, taking in that brain fog, ailments from grief, ailments from contradiction, and then her ropey, stringy period, and this numbness and insensibility, the heaviness of her limbs. And so what we see here are a bunch of remedies for me to research: Ignatia, Sepia, Natrum Muriaticum, phosphorus. So of course I researched all of those. And what I did is I ended up giving her Sepia. So I gave her 30C daily, which is a very common prescription for me to put a homeopathic pellet into a dropper bottle of water and have someone take that every day. And I find that allows me the flexibility of upping the remedy by giving it more, or I can reduce the remedy and give it fewer times per week. So I can adjust if needed, but it gives a little bit of daily support, every day supporting that thyroid gland, supporting the whole system. And so our first follow-up after 2 months showed improvement across the board in almost every symptom. Her brain fog is clearing up. It's 80% better, with a much better ability to concentrate. Her neurological symptoms, as we in quotes, are 20% improved. She has less need to keep busy, and she's more able to chill and relax. She's more relaxed with the state of her house and less need for stimulating activities to feel balanced. Her anxiety about her health has improved 50%. After 4 months, we see improvements are maintained, and we got some blood work done, and we saw that her thyroid hormones are normalizing, that her TSH is lowering because it was too high, indicating hypothyroidism. When your TSH is too high, that's your body saying, come on, thyroid gland, make some more. And your T3, which is the actual thyroid hormone that your thyroid gland outputs, was increasing. And so that's a normalizing situation. So I'm going to just repeat exactly what Sangeeta said before, which is that you need more than supplements and homeopathic remedies to be healthy. And what I didn't put on here is removing the obstacles to cure, which I think is really a great point. And something that's really important is to remove the things that are harming you and your body and creating problems, and then add in things that create healing. And what everybody needs is stress reduction, a regular daily practice of stress reduction. Everybody needs restful sleep, at least 8 hours. And everybody needs to eat whole, healthy foods, including good fats. Everybody needs exercise, and studies show it's actually more beneficial if you like it. So pick something you like. Don't just go to the gym and run on a treadmill because you're just getting it out of the way. Go find something that you like. Maybe it's rock climbing, maybe it's paddle boarding, maybe it's mountain biking. But if you like it, it's more beneficial. You need playtime, just doing something you like. You need connecting time with your spouse, your children, your friends, and you need downtime. alone time where you can reflect and just rest. So these are also really important. It's not just the remedy, it's the three-legged stool of the remedy, plus removing the obstacles to cure and adding in the things that our bodies really need. And as I said before, telling people they need to reduce their stress, people are highly resistant to that. Telling people they need to sleep for 8 hours. Most of my patients like to go to bed at about 1 a.m. because that time is the only time they have to themselves, between 10 p.m. when their kids or their teenagers go to sleep, and they have time to themselves. But it's important to find that time during the day so that you can get your sleep. Here is just a quick slide with some resources. If you want to do homeopathy at home, you really need remedies. And you need books that tell you need the remedies so that you can give them, and you need the books so you know what remedy to give. They go together. And I have a practical guide for homeopathy that I've written that's available for download on my website. It's available automatically when you sign up for my newsletter on my website, but it's also available at this link that I've put here. And I can come back to that if anybody is interested, but that is the end of my presentation. So let me see. Let me go back here. Sangeeta is muted. So maybe now we could take some questions.
Yeah, and you can stop share on your end.
Okay, got it.
And then we'll just go back to.
Yeah,
there we go.
There we go.
So yeah, there was one question someone put in the chat for you, Alexis, about if you could go over how you do the dosing in water.
Oh, great. Okay. So that's something that I do a lot, both for acutes as well as for chronics. And so if I'm going to prescribe, I'll show you. Hold on.
I also.
I'm going to prescribe a chronic remedy.
Yeah, go ahead.
I'm going to put it in a bottle like this. I'll just take 1 or 2 pellets and put it in there, and I fill it with water. And then the person would take, a few drops every day. If I'm going to do it as an acute preparation, I don't get so fussy with a bottle like that. You could just take like a Crystal Geyser 12-ounce water bottle, or even just a mug with some water in it. And I put the pellets in there and let them dissolve. And then that is a way to repeat the remedy. It's in a very gentle way. So if someone has the flu or some kind of illness like that, I often will give the remedy that way so we can give multiple doses. Does that answer your question, Joey? You can unmute yourself if you would like.
Yeah, if anyone wants to speak, you can just unmute yourselves. You can turn on your video. Alexis and I share a homeopathic teacher in common who we both adore, named Will Taylor.
Yes.
If you ever have a chance to watch anything with him, he's getting old and might not be around forever, but he's wonderful. And I don't know if that's where you learned that, Alexis, but I learned water dosing from him, and I also do water dosing for all of my chronic cases pretty much.
I learned it because I learned it the hard way. I wish I had learned it from Will, but no, I learned it from a case that I had of a woman with extreme eczema all over her body. And so I gave her a dry dose, and she had some aggravations. So
yep.
I started doing,
Water
so
dosing cuts down on that.
So I did a lot of research, and I tried this method with her, and it was so effective that I just thought, this is what I need to do with everyone.
Yeah.
So mostly I do that.
Someone just asked a question about thyroidectomy. So if I'm not sure.
Why don't you take that one?
I'm not sure who asked that. I'm going to switch to gallery view so I can see everybody. I only see a last name on that picture, so I'm not sure what your first name is. But if someone has had their thyroid gland removed, then you have to be on thyroid hormone forever, because you need it. Everybody needs it. And my personal preference is to take bioidentical thyroid hormone so not synthroid. Synthroid or levothyroxine is only T4, and it's made in a lab, so it doesn't really match human body, human thyroid. So I like NatureThyroid. There's a few different brands. We have NatureThyroid in my office here. I work at Be Well. This is where I'm in my boss's office right now. We carry NatureThyroid in the office, and it's a combination of T4 and T3. And the benefit of that too is if your adrenal gland or other systems in your body aren't doing that conversion from T4 to T3 very well, it gives you a little added benefit. So that's just my my preference. So there's a couple other questions. Why? So for me, why do you prefer saliva over urine testing? It's not really. They're both good. The dried urine testing, like Dutch test, is just something honestly that I've not done a lot because hormone testing is definitely not the thing I do the most of. I deal mostly with gut health, Lyme disease, co-infections, and mycotoxins. I just don't do as much hormone testing. Dutch tests are very thorough because they look at all the metabolites. So I do find them really useful in women who are on hormone therapy because it tells you exactly how the person's body is processing those hormones, like which metabolites the body's making. But you don't always need all of that information either. Sometimes I just go simpler because it's easier, and saliva tests are easy to do at home. If people have trouble making saliva, then I would go with the urine test, but they're both useful. Just depends on the person.
And then how do you feel about, so I just decided to unmute.
Yeah, much easier.
How do you feel about hormone replacement therapy?
It can be great for some people. I think oftentimes, not always, but oftentimes we jump to replacing things without really doing a deep dive into why the hormones are low to begin with. So my only real issue is I like to exhaust all the possibilities of why are someone's hormones low, because they're or abnormally, the ratio is off. So usually it's estrogen's too high and progesterone's too low in women, but there's often not enough digging deep to figure out why. There's sort of an assumption that when we get to a certain age, I can't tell you how many women come in and say, well, I'm just getting older. And we blame so much on age. And in the United States, we've started to believe that all the symptoms we associate with menopause are normal. And they're really not normal in the rest of the world. They're more normal in a stressed out, overworked, toxic world like the United States. Toxic, literal body toxic burden. But it doesn't have to be that way. And so if it's possible, I always like to try and figure out what we could maybe change in the system to help the body make more hormones, whether someone's 65 or 24. And sometimes that's not possible. And even sometimes in the short term, hormone replacement helps people to feel a little better. But they don't necessarily need to be on it forever either. It could be a temporary thing like a supplement. And then the other thing is often, because I deal with a lot of Lyme disease and chronic infections, that oftentimes when chronic infections are the issue, people will feel worse on hormone replacement therapy, even though their labs indicate that they should feel better. There's no real reason why they shouldn't feel better from a little added progesterone or some estrogen and testosterone cream. So if someone has pretty adverse reactions to even bioidentical hormones, I'm always very suspicious that there's something else going on.
And it's usually like the viruses that you were mentioning earlier, like Epstein-Barr or Lyme?
There's some sort of body burden that's not allowing the body to process the hormones well. There's lots of reasons why that could be. I've just seen it happen most commonly in my patients who have chronic infections of all kinds. So high viral load, sometimes Lyme and co-infections, bacteria, yeast, and parasites in the gut. So any kind of body burden of organisms that are confusing the immune system often also puts a heavy burden on the liver. And the liver is like the place where hormones are made and broken down. So I don't actually scientifically know, just my clinical assumption is that there is some burden on the liver and the immune system. And it's sort of like the bucket's already full and you're adding something else into the bucket that you're asking the body to process, and it just can't do it. And so it responds kind of in the opposite way that you would expect the body to respond. That doesn't happen that commonly, but I've seen it enough that it's almost become a test for me. Like someone will come to me already on hormones, because my boss, Dr. Brent, does a lot of hormone replacement. And they actually feel worse than they did 3 or 4 or 6 months before. And then we start to dig a little deeper and figure out, well, why is that?
Thank you so much.
Yeah.
Any other questions? Anybody have any questions? I have a question.
Yeah.
I have a question that came up during your presentation,
Yeah.
which is how do rest and exercise help heal the gut?
So, well, rest and exercise are a huge part of healing the hormonal system in general. I don't know if it's directly, it depends what's wrong with the gut, but stress in general depletes our immune system or kind of puts a wet blanket on a fire. You know, the immune system can no longer respond appropriately in a timely manner, efficiently. And because 70% of our immune system lives in the gut, any prolonged chronic stress is going to affect immune function in the gut, which is going to make any potential ingestion of bacteria, parasites, antibiotics, it's going to make the ramifications of those things potentially greater because the body's not going to have resistance or resilience. So when you rest when you relax when you eat is important. If you eat when you're really stressed out or you're driving or you're walking or you're doing 3 things at once, the vagus nerve behind the esophagus literally is just flabby. It's not toned. It can't tell the organs to do their job. And so people will have heartburn or indigestion, or stomach acid will be not properly timed with your food, so your food won't be broken down correctly. We really need to be relaxed and calm when we're eating. That sets up a whole improper cascade in the gut. So the kind of systemic rest, you know, like being rested. So getting consistently good sleep is going to mean that your melatonin is right when you go to sleep and your cortisol levels are proper when you wake up at night, and your vagus nerve is well toned and can help your organs to digest your food. So, and exercise is the same way, except the caveat I will add about exercise is that people often think that exercise is enough and they don't put enough. I tend to de-emphasize exercise only because most of the women I see exercise a ton. They don't rest enough and they don't eat regular meals. And so I try to get people to eat at regular times, sleep at regular times, and then exercise when you have extra to give, when you've got energy to burn or you need a little stimulation, but not to the point that you pass out at night or you feel terrible the next day. So overall, like if there is a gut problem, rest will help to regulate digestion, but it will also help heal. Like if you're doing a gut treatment to kill bacteria, yeast, or parasites, the stuff you're taking is going to clean stuff out, but you still have to repair the damage that's left. And so the rest part of it, especially, and healthy food, is just going to help that happen more quickly and efficiently. That was a very long-winded answer for like a very simple question.
Thank you. And it looks like there are a couple of other questions.
Yeah.
Jamie, do you often see heavy metal overload affecting adrenals and hormones, and is chelation a good idea?
And someone also asked about dietary recommendations for hypothyroid and adrenal fatigue.
Oh, I didn't see that. There we go. Yep.
So my dietary recommendations typically when people are depleted, which is often what's happening in low thyroid and low adrenal function, is to eat cooked food, avoid raw foods and dry foods, eat regular meals, especially with adrenal dysfunction. So you want to eat within 1 hour, 1 to 2 hours of waking up. Leave space between meals so your digestion can regulate and your body can build hormones. And you want to eat things that are really easy to digest. So soups and stews, cooked grains, stay away from processed carbohydrates and sugar. I mean, these are kind of my general dietary advice guidelines anyways. But if there's a lot of depletion, you want to eat more from the animal world. If there's gut dysfunction, the first thing to go with gut dysfunction is the good bugs that help us digest plant matter. So people will often have trouble digesting big salads or lots and lots of grains. So especially bone broth and animal protein is usually going to be more deeply nourishing and easier to digest. And it's going to give your body all those amino acids and raw materials it needs to make hormones. So that's kind of, and good fats. I think we both mentioned like good fats are incredibly important for building hormones, nervous system, and brain health. And what was the other question?
About heavy metals.
So I will say heavy metals is something I don't deal a whole lot with. It absolutely can be a part of it. I would be very careful with chelation. I don't recommend IV chelation. I feel like it's most often too harsh for everybody. And I deal with a lot of people who have all these things. So they have mycotoxins, they've got Lyme disease, they have gut dysfunction, they've got adrenal dysfunction and thyroid. I mean, they've got a little bit of everything. And in those cases, you really have to pick off what's on the top of the pile first. And for me, that's almost always gut dysfunction, because without a healthy gut, you're not going to have a healthy liver function. You can't detox anything, metals, toxins, die off, nothing. So you really need solid gut function to be able to withstand and get the benefit from any of the other treatments. And chelation is a pretty harsh treatment. So you really want to nourish and, firm up the body's constitution before you go down that road. But I often find that if you do it in the right order and you really clean someone's body up, if it's heavily toxic, that you can do oral chelation with pretty simple herbs and nutrients, and the body will do a lot of that on its own. But it's not the first thing I start with, unless we find just absolutely nothing else, which so far in my career has never happened. There's almost always something else to deal with. So would you have the same dietary guidelines for managing inflammation and low estrogen? I'm so glad someone asked about intermittent fasting. And another diet question. Nobody wants to talk; they just want to type questions. Okay. So inflammation and low estrogen. It depends what kind of inflammation it is. In general, inflammation is better dealt with on a more paleo-style diet with, of course, quality meat. So grass-fed beef is really high in omega-3 fatty acids, just like deep water fish, but without the metal toxicity, as is grass-fed butter. Anything grass-fed from a cow, although dairy tends to be irritating to people who have gut dysfunction or inflammation. So inflammation is our body's natural immune response to something that's gone wrong. And it's not a bad thing. It's only a bad thing when it keeps going unchecked. So yes, an anti-inflammatory diet would be similar. And low estrogen really depends on why the estrogen is low. Again, I would look at gut and liver dysfunction, figure out why that might be low. And then in someone who's postmenopausal, you might want to do low dose estrogen, testosterone cream, and progesterone at night. I mean, those can be really helpful for a lot of people. And then fat. Oh, Daphne, you asked me the question about fat. I love it. You definitely don't want to avoid fat ever, but especially in children and as we get older. Children need it for developing brains, and as we get older and things just naturally dry out, we also need it to maintain all of that nervous tissue, to prevent the nerves from being deteriorated, to feed the brain. So I would absolutely not avoid fat, but you want quality fats. You want to avoid plant oils, canola, safflower, sunflower, fryer oils, that kind of stuff, and really do healthy meat fats and butter and ghee and olive oil. But fats are important. Oh, were you going to say something, Daphne?
Oh, she started barking just now. My friends will eat no fat. They won't. What would you say to them? I mean, they will eat milk. They will carve the fat off all the meat.
That's a holdover, I think. So that's a holdover from an era, I think. Like when I was a kid, I remember my mother trying to get my father to drink skim milk, and he threw a fit. And he grew up on a dairy farm. He's like, "Are you kidding me? I'm not drinking blue water." So there was a period of time where fat-free was the thing. And sometimes people just get stuck in that and they don't really look for anything else. And so it's a habit. They've just decided probably 20 years ago that low fat was the way to go. And the conventional world also will often vilify fat as being a bad thing because they're not looking at quality or quantity of fat. They're just saying, well, fat, increases heart disease, which is really not true. Sugar and carbohydrates are much, much, much worse for heart disease than fat, or even cholesterol. Cholesterol is such a non-issue, and the overimportance that conventional medicine places on cholesterol is just a giant waste of time. It's really sugar is the big, big, big problem. And the problem with low-fat diets is a lot of those low-fat pre-made foods add sugar or sugar-like things or starches into them to make them thicker and creamier and to make them taste more like full-fat products. So then you're getting the double whammy. You're getting the starches and sugar, and you're not getting the beneficial fats. So I would just do your best to say, you really want to protect your brain from Alzheimer's, eat fat. It really is helpful to prevent dementia and Alzheimer's. And
What
then,
about the intermittent fasting?
yeah, so someone asked about intermittent fasting. So there's a lot of takes on intermittent fasting. If you look at ancient cultures like Ayurvedic and Chinese medicine, they all have the basic dietary advice is, you know, you don't eat past 7 o'clock, you go to bed by 10, you get your 8 hours of sleep, you get up at 6, you eat you do your meditation or whatever in the morning, and eat by 7 or 8. So if you don't eat after 7 and you don't eat till 8 or 9 the next morning, that's 14 hours. But what people have turned that into is they eat at 9 or 10 o'clock at night, and they don't eat till noon or 1 the next day. That is not good for your hormonal system in any way. Our hormonal system, melatonin goes up at night, it makes us sleepy. Cortisol rises between 6 and 7 and wakes us up, and that's what gives us energy to get up. If we don't feed ourselves after cortisol rises, the body feels like it's starving. It thinks it's in a starvation situation and will just turn all of its metabolic processes on slow mode. It kind of still thinks you're asleep. Like, hey, we're giving you this cortisol energy boost, get going. And you're not, and if you don't listen and feed the machine, the machine just puts itself on pause and waits for that fuel to come. So it really is not good for our metabolism. It slows everything down, and it slows the pattern of how hormones are released. Our bodies follow a very specific 24-hour circadian rhythm pattern, and hormones are released at very specific times throughout that period. And if we don't feed ourselves at regular times, we are creating the potential for that system to get thrown out of whack. So you can do intermittent fasting, but do it from dinner until breakfast, not from 10 o'clock until noon the next day. That's fine. And traditionally, breakfast and lunch should be the bigger meals of the day. Dinner should be the lightest. Americans do that in reverse. And that's really not how we are physiologically designed. We have better digestive fire until about 2 p.m. and then it starts to wane, and that fits right in with our cortisol pathways too. So if you follow that hormonal pattern and you eat a very light meal, you're getting that natural intermittent fasting. So the natural version I'm all for. This whole synthetic version of not eating till noon or 2 in the afternoon is a terrible idea.
Any other questions out there? Anybody wish to unmute themselves and say anything?
Just thank you for the call.
Yeah. Celia, I'm glad you made it. I see your name on here, so I'm glad you got the link.
Yes.
Yeah, I'll unmute myself. I'll be brave. Oh, I turned my thing around. Hi. So I thank you so much. So hi, this is so interesting, but I'll be honest with you. If I came to one of you and you asked me like about my symptoms, I swear it would probably take like hours. I mean, I feel like I usually get so, I feel like such a whiner, and I feel like I'm just like, I have this whole treatise of everything that's, so how do you deal with somebody who just like they just have so much going on as far as the history of their symptoms? Like, how do you deal with somebody who just has a long list? I mean, like, how long is your consultation? Like, I feel like I would.
Alexis is probably at least 90 minutes, right?
My consultation is very long, but I cut you off after 3 hours. So,
Oh, 3 hours. Okay.
yeah, my initial consult is 3 hours. And
Wow.
that's because people have a lot to say and we have to get through everything. So, but it's the art of taking the case to be able to get the information that's needed in the time that we have. Most people, most doctors you go to don't have a 3-hour intake. So, It's our job to get you to tell us what we need to know. And we don't have to know everything on the first visit in terms of a homeopathic consult anyway.
Right.
Like we're having a relationship we're not having a one-night stand. We're going to go on and I'm going to learn more and more about you. And maybe in the second consult, you tell me something that I didn't know that helps me refine the way that I'm treating you. But everybody comes in with a really long list. It's just how that's life.
Yeah, that makes me feel better.
Yeah.
And most people have complicated pictures, even if they tell you, they come in and say, I just have migraines. I just need to get rid of my migraines. That's it. And then you start talking to them. They're convinced they only have migraines. And then you just open the door and they suddenly, oh yeah, I'm really constipated. Oh yeah, I have severe anxiety. I mean, there's just so many things that people don't think are connected. And I'm glad you mentioned the building a relationship, because I think that part's really important, especially for me when I'm dealing with these chronic cases that I'm having to kind of strip away layers. It really involves getting to know the person over time and seeing how they respond. Like a lot of times after a month protocol, people will say, I don't feel any different. This happened to me when I was doing homeopathy too, that I don't feel any different. But then you actually come in and I start asking questions. Well, what about this that you told me? And they're like, oh yeah, that thing's gone. It hasn't even happened all month. Oh yeah,
what migraines?
Totally. Yeah,
I don't
haven't
get
had a headache
migraines.
in like
What do
6
you
months.
mean?
But they don't feel like different in some extreme way they were expecting. And so checking in really helps to remind people that they are actually getting better. And especially when people have things like Lyme disease and it can feel like such a drudgery of it, things never improving. It's really good to have the doctor as your cheerleader. Like, no, you are getting better. Remember when you only slept 3 hours at a time and now you're sleeping the whole night? Like, yes, you're still in pain, but you're doing better. And so, yeah, you can never get it all in the first visit. But that's the beauty of working with people long term.
Agreed.
Thank you.
Yeah. Well, if there are no more questions.
Someone asked if, I'm not sure who this question is for, but I believe the answer is yes, we both see remote patients, right?
Yes. Everything right now is on Zoom.
Yeah.
I do have a question. Sorry, let me put the video. I think I heard you saying at the end, Sanjita, that yes, you could have your thyroid recovered, like no medicine needed at the end of the treatment. And like how many years of treatment? And like right now I'm taking 75. Would you slowly go back like 50, 25 until you don't need it at all?
Yeah, but only when the whole person is feeling better. Like weaning off medication is not necessary, but some people just don't want to take a pill for the rest of their life. But they've been told once you start taking thyroid medicine, you have to take it forever. And I've just seen that not be true. I will say, Alexis and I were talking about this a little before everyone arrived, that a lot of my most cured thyroid cases are homeopathic cases at the end of the day. We might have spent 6 months cleaning up their gut and doing other things, but ultimately the thing that kind of cured them or pushed them into that real state of feeling great was a really well chosen homeopathic remedy. I found that sometimes when people's systems are too overburdened with toxins, infections, gut dysbiosis, that even the best homeopathic remedy can't do its best work. Like it can't really get into the system, or it'll last for a little while and then go away. The effects will be felt for a little while, but you just can't make it hold no matter how many times you change the potency and the dosing. And I learned my lesson with that a couple of times in Maine, where everybody had Lyme disease, and that as people's overall system improved, and this is totally my own theory, but because homeopathy is a deep energetic medicine that's working on the vital force, it's like if the vitality is so low and being pulled in so many directions, I feel like your body doesn't have the energy to really give a lasting curative response to that remedy. Even if you give it daily, it's like the body just can't, give it. It just doesn't have anything to give. And so when you remove those things that are in the way, then, the remedy can swoop in and do its job, and the body can respond in an appropriate way, in a lasting way. But there's no time frame as to when people can get off thyroid medication. I had, one woman who came to me with an undiagnosed gluten allergy. We got her off of gluten, did a couple, maybe 3 months of some gut healing and tune-up, and I gave her Natrum Muriaticum from day one, but we also did some other naturopathic stuff. And within 3 months, she had done this herself. I didn't have anything to do with it. She just stopped taking her thyroid medication. She I had given her refills and she just decided she wasn't going to take it anymore. And on testing, her thyroid numbers had normalized. So, you know, that is probably atypical in how fast that happened. I would say that was maybe 6 months max. I don't really remember, but somewhere between 3 and 6 for a more complex case. But it is possible. Unless the thyroid
Thank
has
you.
been radiated or cut out, it can potentially be revived.
Is that the same for the adrenals?
Thank you.
The adrenals even more so, because the adrenal glands they're our energy center in a different way. The thyroid manages metabolism, but the adrenal system is kind of our natural opiates. Cortisol is kind of like natural Advil. It's a natural anti-inflammatory. So when we sleep at night, the low level of cortisol heals up any inflammatory oxidative damage that's happened during the day, just normal stuff that happens from being alive. But if our body's overburdened and the adrenal glands are, you know, we're really stressed out or we're eating improperly or there's chronic inflammation, they're going to be pumping out too much cortisol and then eventually too little. But when they're the great example of when you take things out of the way and you change lifestyle and diet habits and you give some adrenal support, the adrenals can come back relatively quickly. But it depends, you know, I would say 3 months. 3 months is kind of my window for most things. Within 3 months, you should be feeling better on some level. But it depends how many things in the system there are to remove. So again, with something really deep like chronic Lyme disease that someone's maybe had for 20 years, that's going to take longer. And I pretty much tell all my Lyme disease patients a year of regular check-ins. You won't feel terrible that whole time, but like to really feel like you're back to what you want to be, a year. So it depends really on the burden, but the adrenal glands, I think, respond. Same with the liver. The liver and the adrenals just respond pretty easily when they're given the right substances, the right support.
Thank you.
Oh, there was some question down here. Oh, just a bunch of thank yous.
All right. Well, I think I
Yeah.
think we can sign off. Thank you all so much for joining us. It's really been fun and great to see you guys.
Yep. And I'll send out the video tomorrow, and feel free to share it with anyone that might want to see it that wasn't here. I know a lot of people who couldn't make it said they were going to watch it. So, and let us know if you have any follow-up questions that occurred.
And we'll have another presentation. We'll let you know.
Yeah, it'll be next month sometime.
Yeah.
Thanks a lot. Good night.
Wonderful. Thanks, you guys.
Bye.